Good morning, student. So last lecture or last video we start human health and diseases of biology subject. In that we were studying health, then disease, different types of disease. We are get differentiated them, then different types of pathogens, parasite, and different types of parasite with their examples. And lastly, the list of common communicable disease or the infectious disease. In the disease, we add three different types of disease, that is a dengue and AIDS and cancer. I am going to make a separate video on AIDS and cancer. So today we are going to study the bacterial disease, that is a typhoid. Before to study the disease, before that you should know these 6 points about each disease. Okay, so if you start describe or explain any disease, so you should know these 6 points. In that, first point is that scientific name of that parasite. If you know the disease, so you should know which parasite caused that disease. So scientific name of that parasite, maybe the zoological or the botanical. So here is all the zoological names. So scientific name of that parasite. There may be one sentence question asked on this, like write down the parasitic name of typhoid, write down the parasitic name of pneumonia, like this. Okay. Next is the symptoms. So this parasite when enter into the human body. Okay. So after entering the parasite, the body gives some physical or mental features, and that features are called as the symptoms. Third is mode of transmission or way of transmission, and in that we should also explain the life cycle of that parasite if necessary. Fourth is the diagnosis, fifth treatment, and the last one is the prevention. If you write this 6 point for any disease, then you got the all marks. So let us see the first disease, that is the typhoid. Typhoid is the bacterial disease. Typhoid, the name is given by Louis in 1829, which is derivatives from typhus. That typhoid is caused by Salmonella typhi. So Salmonella typhi is the scientific name of that disease or that parasite. Scientific name of that parasite which causes typhoid disease. Okay. So you can easily remember the scientific name, because the scientific name includes some structure or some name which include in the disease, means typhoid, typhi, like this. Okay, so you can easily identify that typhoid is caused by Salmonella typhi, because typhi is here. Okay, it is pathogenic gram-negative bacteria which is found in the intestinal lumen of infected person. See here that Salmonella typhi is found in the intestinal lumen of infected person. And what is about the Salmonella typhi? So Salmonella typhi is pathogenicity is due to the outer membrane consisting largely of lipopolysaccharides, which is called as the LPS, which protect the bacteria from the environment. And that LPS is made up of O antigen and the flagella with antigen H. See here, we will study the structure of Salmonella typhi. Salmonella typhi having the tail-like structure, which is called as the flagella. And as I know that the flagella is made up of antigen H. So flagella is there, which is a tail-like structure. There are number of thread-like structure are here. Okay, these thread-like structures are called as the pili. Okay, and that pili and flagella having the function for the movement. If the Salmonella typhi is mixed with the water, at that time the flagella and pili help for the swimming in the water. The cell contain different cell organelles and genetic materials. There is one more structure of Salmonella typhi. See here, there are the number of flagella, which is made up of H antigen, and the outermost layer is made up of O antigen. Here is also flagellae, pili, the genetic material, that is DNA, plasmids, and the cell organelle like cytoplasm, ribosomes. Okay. Now, mode of transmission. Typhoid is food and waterborne diseases. Why? Because it is transmitted by the injection of food or water contaminated with feces of an infected person. Feces means the stool. Feces, stool or undigested matter go outside the body in the digestive system. You already study in digestive system the undigested food go outside the body, so that matter is called as the feces or the stool. Okay, so insects like housefly, cockroaches are feeding on that fecal matter. See here, suppose this is a fecal matter and that housefly and cockroaches are feed on that fecal matter. Same housefly and cockroaches are also feed on the food. That food are eaten by human. So indirectly, the fecal matter which consists of Salmonella typhi, they are passed to the food to the human. Okay, indirectly. So that insect are, that is housefly or cockroaches, feeding on first of all fecal matter. Okay, in fecal matter the Salmonella typhi are enter into the housefly or cockroaches, and that housefly or cockroaches again eat the food which eaten by human, and that food is going to the inside of that human. Okay, so that Salmonella typhi enter into the human through housefly and cockroaches. Okay, so when the parasite enter into our body, so it gives the physical or mental features. So which are those? These are here, which is called as the symptoms. So these are the high fever, the body temperature get increases, then headache, weakness, dry cough, stomach pain, constipation, and red rashes on your body. These are the different symptoms of typhoid. One more symptoms is there, that is a white coating on the tongue. What? White coating on the tongue. This is the important feature or symptoms for the typhoid. So how to diagnose? The person get typhoid. So diagnosis is the Widal test. It is a titrate test where on the basis of color you can diagnose the typhoid. Here is treatment also. If the typhoid is severe in case, okay, if the typhoid is severe in case, the surgical method is applied. That is the removal of gall bladder. Okay, there are number of antibiotics. Antibiotics are also there, like a chloromycetin. Okay, so in diagnosis, Widal test, surgical method, that is a removal of gallbladder, but only when the severe cases, and the antibiotics, chloromycetin. Now last, the prevention. As recommended by WHO, that is the World Health Organization, they recommended 2 vaccines for the treatment of typhoid. First is the oral, that is TY21A vaccine, and the second one is injectable typhoid polysaccharide vaccine, and these are solved by typhim VI and the typhirixine. Okay, so you should remember the prevention method, that is the 2 vaccines of typhoid. Which are those? First is the oral, that is TY21A vaccine, and the second is injectable, that is the typhoid polysaccharide vaccines. Okay, next, so next disease is pneumonia. This is a bacterial disease. In pneumonia, bacteria like Streptococcus pneumoniae and Haemophilus influenzae are responsible for the disease pneumonia in the human, which infect the alveoli of the lungs and the air-filled sac. What about that structure? Let us see. What is the alveoli, air sac or air space? So when the air enter into the lungs through the nose, okay, if you take the ultrastructure of this lung, okay, so take the ultrastructure, then it gives this structure. Okay, this is the ultrastructure of that lungs. In that we see the bronchioles, where the air is coming from that bronchioles and enter into the alveoli, and that alveoli contain number of air spaces. This is a normal condition or normal stage of lungs. But if the person is pneumonic, okay, if the person is pneumonic and if you take the ultrastructure of these lungs, it gives like this structure. the bronchioles get swelling. Here no swelling is there. Okay, so bronchioles get swelling. Because of that, decrease in airflow, we cannot respire properly. Okay, so why bronchioles get swelling? Because the air space, see here, the air space present in these alveoli are filled with the fluid which is greenish or elevation color. Okay, so the air space which is present in the alveoli are filled with the fluid, and because of that, the wall of alveoli, see here, that wall, the wall of alveoli are inflammation, and because of that also the bronchioles get swelling, and because of that decreases the airflow. So this is occurs in the pneumonic person, and that's why we say, as a result of, we say that the infection, the alveoli filled with the fluid, leading to severe problem in respiration because air cannot enter into the lungs properly. Inflammatory condition of lungs or alveoli of the lungs. Why? Because that air space is filled with the fluid, and that pneumonia is also called as the chemical burns, physical injury to the lungs. These are the different names given by the pneumonia. Infection is common caused by involve the different pathogens like bacteria, viruses, fungi and the parasites. Here. Now the parasite enter into the human body. Now it gives the symptoms. Which symptoms? First, high fever. The body temperature get increases. Now chills. Chills means shivering. Then skin. What about skin? So skin get clamminess. Clamminess means sweaty, wet like. Okay. Next is the bluish. Because of air cannot enter properly into the lungs. That's why deficiency of oxygen is there. Okay. Because of that, the skin become bluish. Next, center. In central, that headache, loss of appetite, भूख नहीं लगना, mood swing means rapidly change in your mood, low blood pressure, high heart rate, then nausea. Nausea means you not feeling well. Okay, and you feel like you have the vomiting, ulti जैसा लगना है, just a feeling of that vomiting. One more, vomiting also the symptoms. Joint pain, cough with sputum, it is greenish or elevation color. Then the pleuritic chest pain. Okay, when we breathe deep, at that time the chest pain is occur. Hemoptysis. Hemoptysis is the stage when you coughing, the blood is come into the cough. Why? Because when the air come into the air space and which is filled with the fluid, so when we breathe deep at that time, or when we cough at that time, the blood vessels which occurs into their lungs, they are get break, and the cough contains some amount of blood which is called as the hemoptysis. Okay, then fatigues, you get some fatigue like a थक जाते हो आप जल्दी से. Okay, so these are the different symptoms of the pneumonia. Here are the different types of pneumonia. Some of the different types of pneumonia. First is the aspergillus mold like a structure. See here, it is some bulb like structure, which bulb having the tubular like structure. Okay. The next is the adenovirus, which is hexagonal in structure, and I think it contains the genetic material. Okay. Next one is the streptococcus, which is rounded in structure. There are except these three, another more types are also there present, but some of the types of pneumonia is here, like the aspergillus mold, adenovirus and the streptococcus. So mode of transmission about the pneumonia. So mostly the pneumonia is spread by direct person to person contact, and it also spread by droplets releasing from the mouth of infected person. The small droplets, when the infected person get talk to some other person, at that time the small droplets are coming from their mouth. Okay, even by using shear cloth, comb, sandals, these are the different transmission mode of pneumonia. How to diagnose the pneumonia? So, courses of treatment depending upon the pathogen. As we said that there are the different pathogens are there like bacteria, viruses, fungi. So, on the basis of that, the treatments are also different. For bacterial pneumonia, take the example for the bacterial pneumonia. So, which treatment is there? So, there are the antibiotics like penicillin, ampicillin and chloramphenicol are the effective. So, see here bacterial pneumonia, only for the bacterial pneumonia. Antibiotics like benzylpenicillin, ampicillin and chloramphenicol, these are the effective. Now, how to prevent the pneumonia? How to prevent the pneumonia? So, there are the number of vaccines are there, and which is very important for both child as well as adult. Vaccine against Haemophilus influenzae and Streptococcus pneumoniae in the first year of life have greatly reduced the chance of pneumonia in the child. So, if you take the vaccine in the first year of life, okay, if you get the take the vaccine in the first year of your life, then it is the greatly reduce the chances of that pneumonia in their life. Okay, so it is a useful prevention for the pneumonia. Next one is the common cold. Okay, this is a common cold causes because of the viruses. So which viruses? See here. So common cold is also known as nasopharyngitis. Naso means nose. Okay, so nasopharyngitis, then acute viral rhinopharyngitis, acute oryza or a cold. These are the different names for the common cold. Viral infection disease of the upper respiratory region. So, common cold is the infectious disease which affect the upper respiratory region of the human and which is caused by group of viruses. For example, rhinoviruses and coronaviruses. This is the scientific name of that parasite. Rhinoviruses and the coronaviruses. What is the symptoms of this common cold? Cough, okay, then sore throat, running nose and the fever, muscles rashes, fatigue, headache, shivering, loss of appetite, and this is usually recover in 7 to 10 days. How to prevent? Because it is a very common method or common symptoms. You can easily find each and every person. Okay, so what is the prevention? Prevention is staying away from affecting person which having the cold. Those person having the cold, you should away from that person. Washing hands with soap and water. Okay, then use of handkerchiefs or to cover the nose and mouth during the coughing and the sneezing. Use alcohol based sanitizer. So these are the different prevention methods for the common cold.